So I'm often asked, how can I overcome my anxiety without using medication? And the answer is, medication is not going to change the underlying cause of your anxiety. Medications are designed solely to reduce symptoms, and they can have their place as a temporary measure, but you have to correct the underlying psychological cause if you want to break free from anxiety and panic attacks and OCD and other forms of anxiety disorder. All anxiety disorders are caused by an underlying psychological habit. So this habit is a psychological process that's triggered by various factors that might be external triggers. For example, in a phobia, there are very specific external triggers. Driving anxiety is very common, and that's triggered by certain road conditions. It could be health anxiety, which is triggered by visits to see a doctor or anticipation of going to see a doctor, and so on. External triggers is one big factor for many people, but there are also internal triggers in the form of thoughts and beliefs and memories and other cognitive content. So whatever the trigger is, it's what is triggered that's important. It's not effective to try and avoid external or internal triggers. That is not going to help in the long run. You have to change that underlying psychological habit that gets triggered. And we do this in mindfulness therapy by looking at the relationship that you have to the emotions that get triggered, the anxiety, and to the triggers themselves. So we work with both of these, and we learn how to break free from that essentially unconscious, habitual reaction to these triggers. That's the most important thing, how to break that unconscious habit. We do this by actually focusing conscious awareness on those triggers, whether they're external or internal, using mindfulness meditation. So mindfulness meditation is simply a way of breaking free from habits of the mind that cause emotional suffering. There are many styles of meditation, of course, and many interpretations of what meditation means, but in this context, when we're talking about mindfulness meditation, we are learning how to free the mind from suffering. So we learn how to work with the internal triggers and the external triggers by meditating on them, by imagining them, and then looking for the emotion that gets triggered, and then helping to heal that emotion, helping to neutralize it through a number of mindfulness techniques that I will teach you. And I will teach you how to meditate on your emotions and how to free yourself from these emotional habits during our Skype therapy sessions. One of the key things we focus on is neutralizing reactivity to those triggers. It's habitual, as I've been saying, and habit thrives on blind, unconscious reactivity. So by simply the process of developing more and more conscious awareness around the triggers, you will be able to break free from them to a greater and greater extent until those triggers are no longer effective at triggering anxiety. So that's one big area of mindfulness therapy. The problem for most people is that they do not bring conscious awareness to their triggers. They simply cultivate avoidance or aversion of those towards those triggers. They run away from them. They try to suppress them. They try to escape the emotional pain. But as you will know, that will not work. Any form of avoidance will simply make the problem worse, and any form of aversion or suppression of your emotions will simply strengthen them. It's by doing the opposite, by cultivating non-avoidance and non-aversion, actually friendliness towards your anxiety, that you can actually help it change and heal. So we not only develop more consciousness, but we also develop this quality of friendliness or compassion towards those emotions themselves. And this greatly accelerates the process of healing for emotional pain of all kinds, but especially for anxiety and fear. Another thing that we explore during mindfulness therapy is the imagery of the emotions that get triggered. And we look at changing this imagery, how you see the emotion in the mind, and helping it resolve in that way, because when you change the imagery of an emotion, you change the emotion. So typically, intense emotions like a panic attack or extreme anxiety is very large in size. Its imagery is very large. And simply learning how to make that imagery smaller in size can be quite remarkably effective at reducing the intensity of the anxiety. There are many other ways we can work with emotional imagery, and they're all very, very effective indeed. If you'd like to learn more about how to overcome anxiety without using medications, and you'd like to learn how to heal anxiety by using mindfulness therapy, which I offer online via Skype, then please contact me so we can schedule a Skype therapy session for overcoming your anxiety. Thank you.